Why does it say remove over my face? Hey, good evening, everyone. This is Community Spotlight, and this is your host, Brenda Charles-Edwards, the host of Seniors Matter. It is a privilege to be here this evening. I have a very special guest. His name is Nathan Yemane, Managing Director of YBG Healthcare, and he's going to tell his story towards opening the first African-American hospice facility in the state of Washington. Welcome to the show, Nathan. How are you?
I'm doing well. Thank you so much for having me, Brenda. I appreciate it.
Oh, hey, my pleasure. A friend of mine introduced us by email, and she told me a little bit about you. And I said, okay, well, we need to talk. So the world needs to know, especially the state of Washington, of what's going on in King County. Or should I say, what's not going on yet in King County? So give
Right.
us some background information on yourself.
Sure. Yeah. So I grew up. I graduated from high school, not too far from here in Auburn, Washington, Auburn High School, and really have been just involved in social work for. I graduated with my MSW in 2010. And so, as a social worker, got involved in medical social work and really got into social work primarily due to my father's influence. He's working in the Seattle area. He had worked in the Seattle area for decades, and he passed away in 2020. And he did a lot of grant writing, did a lot of nonprofit work in the Seattle area. But because of his influence, I got into social work and got into medical social work, and had been working in the hospice field, but then also had worked at a medical center before and with veterans. And but around the time that he passed away, just with his end of life care, but then also just kind of realizing in the healthcare field how much disparities and inequities exist, really made me think about and really seriously consider doing something. And to be honest with you, I have personal stories as a social worker, going into people's homes, as a licensed social worker, going into nursing homes and working with people from underrepresented populations, specifically Black families and patients who've historically been mistreated. And I realized that something needs to be done at end of life care, and there are significant disparities in end of life care when it comes to underrepresented people groups, African Americans in this country. And so I wanted to make a change, especially as a social worker.
So tell me, should I say, tell the audience the story you told me about an African-American family that wanted to have an African-American nurse take care of their
Right.
loved one.
Right. Yeah. And so, that situation kind of was, it really fueled me in terms of what I'm doing now. It was a family that had historically just had bad experiences within the healthcare system. We know how the healthcare system has been towards Black families and Black individuals historically. You and I talked about, and you mentioned the Tuskegee experiments. We talked about Henrietta Lacks, but then we also talked about, not very direct ways, but still very impactful ways by which healthcare systems have impacted Black families, Black individuals. We talked about a medical center that was built on land that was taken from the homes of Black families under, eminent domain. And so that hospital was built on homes that used to be Black, that used to belong to Black families. And so how do you, if you had your home taken, or how do you as a child of somebody that had the home there taken, or as a grandchild or great grandchild, ever trust a hospital that was built on the land that was taken from you? And so historical mistreatment is what we're talking about, right? Historical injustices that lead to a lack of trust that people have. And that was the case with the family I was working with. They had a lack of trust. And so they asked for an African-American nurse. And they were later labeled by the agency as just being racist for asking for a Black nurse. because
That's
that
truly
agency
amazing.
did not relate, did not empathize, and it was also an issue of uh, at the top, at the governing body, there just wasn't representation. And I'll just tell you this right now: in healthcare, uh, entities, and I'm talking about not just hospitals, but home health companies and things related to healthcare entities in the United States. Only 2% of those entities have um, people of color represented in their governing bodies. So if you don't have any kind of representation up top, everything trickles down. And if lack of representation is what is up top, you're not going to get a whole lot of change in terms of equity and in terms of like long-term essential change uh, because of people just up at the top not being able to relate. At the end of the day, that's what it comes down to. So those are some of the important reasons why I'm in pursuing this endeavor.
That reminds me, a couple of weeks ago, I had Attorney General Bob Ferguson on my show, and he was talking about how the people at the top were not making their employees follow the rules for helping those that are underserved that may not have the money to pay for their bill get the treatment and discounts, whatever the hospital has. And he ended up suing a number of hospitals for that very reason. It starts at
Right.
the top, like you said.
Yeah, and I'll tell you this: 48% of hospitals in the United States right now have zero representation in their governing boards, zero ethnic or racial minority representation.
Wow.
And so that's one out of two hospitals that you drive by every day. At the top, there is no ethnic or minority representation at the top. One out of every two hospitals. And so that just goes to show you, it just paints a picture that things have to change. And if things don't change at the top, they're not going to change at all. You know how it goes. That's with
Right.
that's with everything.
Absolutely. So what are the disparities and inequities a result of, besides lack of empathy?
Lack of trust. Historically, like I said, just there's just not been a whole lot of there's just been a lot of injustices, like we mentioned. Another reason is that when there's been focus put on removing disparities and inequities, it's rarely involved end of life care. It might have been and had to do with things like aggressive treatment, let's say, and also maybe something that is geared more towards uh, you know youth, for instance. But it's rarely looked at end of life care and when it comes to the elderly population. Uh, uh, One of the reasons I could tell you that with certainty is because there's not enough advocacy. When was the last time you heard somebody advocating for the African American elder population when it comes to, for instance, healthcare? Maybe recently because of COVID, but prior to that, you just didn't hear about it as much. I'll tell you this statistic that a lot of people don't know about. Among Medicare beneficiaries, and when we talk about Medicare beneficiaries, we're talking about individuals that are 65 and above, right?
Right.
Among Medicare beneficiaries, Black Medicare beneficiaries out of any other people group in that category go to the ER department the most. They are admitted for 2 or more nights in hospitals the most, and they also have the highest rate of being readmitted into these hospitals. And a lot of that has to do with individuals who have terminal illness, who could be getting a hospice care.
Right.
And the reason that they're not is because there is a lot of hesitancy and trepidation and just a lack of trust. A lot of that has to do with when people don't see someone that looks like them on the other side, when they don't see representation on the other side, it's hard to trust. When they don't see people that understand the historical context of how the healthcare system in the United States has wronged people of color for decades and generations, more than decades, hundreds, 200, 300. So it's one of those things where, when you don't hear statistics and numbers about a certain issue, it's hard to know if there is inequity or disparity there. Well, that's what I'm about. I did my homework. I looked into these things. I read, and provided data from medical journals, academic journals, in our application to the state for our hospice application. We made sure that we backed our purpose and the premise of what we're trying to do. We back that up with data and statistics that really does show the disparities and inequities in end of life care and hospice.
If you're just tuning in, you're listening live to Community Spotlight with your host, Brenda Charles-Edwards, on www.rainieravenueradio.world, your community radio station. Do you know what's the best gift we can give ourselves and our loved ones? Join me on Zoom for a group or individual session on end-of-life planning. You can reach me at 206-683-2636. My guest is Nathan Yemane. Yemane, licensed clinical social worker and the managing director of YBG Healthcare, who is awaiting state approval to open the first African-American hospice in Washington state. A public hearing will be held Wednesday, May 25th at 9 a.m. on Microsoft Teams. The call-in number, which is audio only, is 1-564-99-2000, and the conference ID number is 730-728-801#. It should be on your screen, but in case it isn't, one more time, it's 1-564-999-2000, and the conference ID number is 730-728-801#. So, what have you decided to do about these disparities? Well, I guess we really kind of talked about that, but I guess the bigger question is, are you working alone or do you have a team?
That's a good question. Yes, so I have a team. So our medical director is Dr. Carla Ainsworth. Dr. Carla Ainsworth is someone who has certification in palliative and hospice care, and also is someone that has been doing primary care for a long time. Currently with Ira Primary Care Clinic, and she's also worked at Swedish. She is African American and understands the need and understands the disparities that we're trying to address. Was someone that has seen everything I'm talking about, because her clinic is in the CD in the Central District on 23rd and Jackson, and so a lot of our patients are African American elderly individuals who are African American, and so she understands the need. She sees the ins and outs of things, and has been very instrumental in being supportive of us. So she is our medical director, and then David Turner is my partner. He is my partner in crime when it comes to this project, and he established the first Black-owned hospice in Tennessee, and also the first Black-owned hospice in Michigan. One of the things that we wanted to do is we wanted to be able to approach this with the idea that we are wanting to start something that is not new. It is something that we know has worked in Michigan. We know has worked in Tennessee. In fact, the hospice that David had started in Tennessee was covered by NPR at the end of 2021, December 2021. And the families that were interviewed by NPR, the nurses that were interviewed by NPR, all African American families, were just talking about how important it was to have a culturally relevant service, culturally competent service, and to have representation, and what it meant for them to be able to talk to someone that represented them, who looked like them, that understands the reasons for why they have a lack of trust, and doesn't dismiss that lack of trust as being racist, but more so understands that lack of trust comes from a history of mistreatment and being sensitive to that. And so that NPR article is great. Again, the name of the hospice is Heart and Soul Hospice. If you Google Heart and Soul Hospice, Nashville, NPR, that article will pop up. It's a good read. And it's the first article that I know NPR has done about a Black-owned hospice. I know that.
So state your agency's name and then tell us the significance of the agency's name.
Okay. Thank you for asking me that. The agency's name is YBG Healthcare. So until we are approved by the state, we operate as YBG Healthcare. When we are given a certificate, we're going to be YBG Healthcare, doing business as Heart and Soul Hospice, which is the same name in Nashville and Detroit. We want to have that continuity. We want to be able to show people that we're doing good work in Michigan, doing good work in Nashville, and we will do good work in King County. But YBG Healthcare, that's my father's initials, and I wanted to have that name YBG Healthcare be about him because he did a lot of work, a lot of good work in Seattle. In fact, when he passed away, the city of Seattle wrote a proclamation, and December 7th, 2021 was declared as his day. And so it was one of those things where his hard work in terms of doing grassroots community work in the Seattle area, his work in the nonprofit sector, worked for the city of Seattle as a mayor's advisor, was highlighted, and he was credited for that. And so his name, Yemane Mikhail, is his name. And I wanted to honor him. We have to honor our elders, those who have gone before us. And I feel like had it not been for him, I wouldn't be doing social work. I would not be doing social work.
That's a beautiful legacy.
Yeah. And so I think that's another thing about this project is that we're not from out of town. We're not from we're doing something and building on existing legacies, right? And we're building on existing footprints. We're not we have connections with community organizations. We have connections with churches. As I had told you, Dr. Anderson at First AME, I had visited with him and also had visited with Dr. Phyllis, his wife, and gotten support from them. Also got support from churches like New Hope Missionary Baptist Church, Dr. Jeffrey, Cassandra, and the folks there that have been really instrumental and just being willing to have that conversation. Right. And I understand the importance of faith communities and within our community and their role in being able to facilitate discussions about healthcare and doing things as it relates to healthcare. You'd mentioned about how First AME had conducted a vaccination clinic. Right. So the church can play such a pivotal role and has played a pivotal role in addressing healthcare needs in the community. And you could probably talk a lot about that.
Absolutely. So now, Nathan, I know the process. Well, I just know a little bit. You know more of starting a hospice program is not easy and it's expensive. So what is the process and where are you in it?
Yeah, thank you for asking that. So we've submitted our application and we are one of 4 applicants. The state is looking at and will only be selecting 2 of the 4 applicants. So right now we are in the review process, and on May 25th, which is in a couple of days, there will be a public hearing on all the projects, all 4 projects, including ours. And so the state is wanting to hear from the community, from King County, and is also wanting to make sure that all that is incorporated in their decision making. But that's where we're at. We have submitted our application. We're being reviewed. We're one of 4, but only 2 will be selected. And we just feel strongly that because of what we're presenting, and again, we're the only applicant out of the 4 applications that have been submitted. We're the only applicant that is talking about disparities within the Black community when it comes to end-of-life care and hospice, and what answers we will present and bring. Now, we have said and will continue to say and have stated in the application that we are for everybody. Our care and our services are for the general public. But we are also saying, even though we're here for the general public, we have the expertise and experience and people like David Turner and Dr. Carla Ainsworth, who have worked in the Black community and are able to affect change at end of life care within that community, on top of being there for the general public.
There's an audience question that says, how much training is required to become a certified hospice RN?
That's a good question. So, obviously, having that registered nurse license is necessary in some states. Depending on what state you're talking about, you could do hospice work as an LPN without having your RN, and in some other states you have to have your RN. As far as from my knowledge and what I know, the RN is enough. I know in terms of training, a lot of nurses come in and they have to shadow and kind of they need time to be acquainted with what exactly hospice care is, because hospice care obviously is very different than what you see in like, let's say, care in a hospital. In hospice care, you don't think about aggressive treatment. You think about palliative care, which is pain management, making sure that the person's pain is not only managed, but that they're comfortable and that they also are living, that they have quality of life. Absolutely. And so a lot of that also means not just the work of a nurse, but also a chaplain is involved, a social worker is involved, an aide, a hospice aide comes in and is able to provide hygiene needs. And a lot of this care, or all this care, is provided at the residence of where the patient is. We go to them. They never have to come to us. That's the thing about hospice that a lot of people I might not be aware of, is that where you get the care is where you live. Wherever you call home is where we come to provide that care. And so again, as far as nursing goes, a lot of the training comes within the hospice facility, or the agency is able to provide that training. I know that some nursing programs have placements for internships in hospice or doing end of life care, and that obviously gives somebody a leg up in terms of experience. But as far as I know, there aren't any hospice nursing schools. There's just nursing schools out there, and you go through them, and then you start working in hospice and learning that.
So I want to get this in before we have to close. So the Department of Health is who's going to make the decision on whether or not your hospice is approved, right?
That's correct.
So how can people support you?
They could support us by doing this. If you believe in the things that I shared today, and you believe in what we just discussed, you could send an email. If you could send an email before May 25th, if you could send an email to fslcon@doh.wa.gov. I'll say that again. F as in Frank, S as in Sam, L as in Larry, C as in California, O as in Oliver, N as in New York, at DOH, Department of Health, .wa.gov. If you could send an email there and just let them know that you have heard the explanation given about this hospice project and that you are in agreement with it. If you could say that would let them know that the community does care about Black-owned healthcare. And the importance of Black-owned healthcare goes beyond hospice. It's about being able to provide healthcare that has representation, where people could feel like they're seen and represented. And I feel like in doing that, a lot of disparities and inequities are addressed. And we're moving towards closing the gap.
And you can also attend the public hearing, the virtual public hearing on Teams by audio. That's 1-564-499-2000. That's 1-564-499-2000. The ID number is 730-728-801#. That's 730-728-801#. So, folks, we have an opportunity to make a difference. So please attend either by audio or send in your comments that goes to the Certificate of Need program at the Department of Health. And I want to thank you, Nathan, for having the idea, the courage to put forth this, and just, like I said, making a difference. We need to stop these disparities that we have, and we just need to go forward. I thought of something while you were talking. When I was 10 years old, I had a really bad nosebleed. And they took me to this doctor. He cauterized my nose, but I'd lost so much blood, they put me in the hospital. And outside the door were two nurses. And the one nurse said, she lost so much blood that if she was white, she'd be pale. And I was kind of, I just kind of like, what does that mean? But anyway, just come out, folks. You can make a difference. Please support Nathan and what he's trying to do. And let's hope, Nathan, you're going to be on my show on Friday, June 3rd at Seniors Matter. And David, if David doesn't make that one, he'll be on the next week with you on Friday, June 10th. So keep a lookout, folks. I'll keep you posted. They'll be on Seniors Matter at 12:30 on Friday afternoon. So thank you so much for listening, and I appreciate all of you that have responded to my emails that I sent out and sending it out to your network. Thank you, thank you, thank you. And a special thanks to you, Nathan. It was great talking.
Yes, thank you for having me. And one, if I could say one last thing, you and I talked on the phone, and one of the things that I remember I told you that I want to say again is that you are somebody that has advocated for a lot of individuals, whether it's at end of life care or at some point in their healthcare journey. You have advocated for them. You had spoken up when maybe they couldn't have, and was there to talk to their doctors and their medical providers. And you've been in the front lines. And I told you that's what I know. I started out as a hospice social worker, going into nursing homes, into apartments, wherever the patients are at. And I think it's people like us that have seen the front lines that could really make a difference, because we have seen the issue firsthand. We've seen and have been on the front row seat watching the needs as they transpired. And so I just want to say, for those of you that are out there that are in the front lines, take what you're seeing and make a difference. Take what you're seeing and experiencing and do something about it.
Be a patient advocate and help where you can.
Yes.
All right, folks. Thank you so much, Nathan. We'll be talking soon. And for the rest of my audience, once again, thank you for listening. And please support Nathan and what he's trying to do for all of us. This is Community Spotlight. This is Brenda Charles-Edwards, host of Seniors Matter, signing off. We'll see you on Friday at 12:30 on Seniors Matter. Good night.
Here with the Rainier Avenue Radio traffic update. You can listen to